Hi, it's Julien Barker. I'm here with Steve, who's been surfing this morning. He's just telling me he's got some knee trouble, which is partly to possibly surfer's knee. Actually, there was a thing called surfer's knee, from duck diving, and it's been a bit creaky. I brought the model here just to show you. So lumbar 5, lumbar 4. Certainly, when it comes to knee, it's the one above it, lumbar 3, and we're going to be looking at that rotation. Just a thing. I think I've had some YouTube comments about, does it move the bone? Well, the studies have been done a long time ago. That obviously through skin, through muscle, but when we're coming into the inferior articular process and we're actually doing that adjustment, that bone is going to move. You can hopefully just, if I zoom right in there, you can actually just see it. Look there, there's setting 4. Even on this model, you can see there is movement, there's big movement. 1.8 millimeters, and it's going to affect the disc, it's going to affect the nerve, it's going to affect the muscles. But let's get into Steve's knee. Thanks. So best knee up first, well done. I've had surfer's knee as well from in the early days of paddling out on a longboard, knees up, and you get the lumps come up on your knee, and yeah, it's horrible.
I try not to do it. I try to use my foot, but
yeah, good luck with that. Yeah,
every now and then.
Yeah, it's so ingrained in that action, especially on the when you're ducking under bigger waves, and yeah, okay, and so you're solid half an inch short on that. Right leg there, comes up into a possibility 1, so much to do. Okay, so I'll go through the essential scan at a pace, kind of clinic pace. So sacrum, pelvis, ischial tuberosity, some improvement, not level. Squeeze your knees together, let go. I think we'll leave that one alone. Right hand up behind your back. Swap your hands around. Both hands up behind your back together. Both back down by side. So clear L5 on the right. We'll start there, and then we'll check L3 as we're going through.
What does the possibility 1 then?
Possibility 1 is your is normal, is straightforward. Possibility 2 is usually some kind of acute trauma. Although I did have one this morning that was completely asymptomatic, and it was just a possibility 2. And as soon as I adjusted L2, everything cleared, and I found one other point to adjust. Possibility 3 is what we're trying to get to, all level. So it's more the finding rather than any diagnostic thing. But certainly possibility 2s are often how you meet people at the beginning. There's usually stuff going on. Okay. That answer your question?
Yeah.
Yeah. Lift the right hip up off the couch. That question. What? Okay. Yeah. So definite L3 there. So, iliac crest, 4, come up, find the top across, L3. Right hand up by your face. Big deep breath in and out. Left hand up as well. Both back down by sides. And you said lots of sitting down and college work as well, didn't you?
Yeah.
So yeah. And then eating, sleeping, and family life. That's the one. Turn your head to the right. Lift the right shoulder off the couch. Back down. Shrug both shoulders up to your ears. Down. Squeeze the right elbow flat against your side and let go. Squeeze the left one and let go. Shrug your shoulders up and roll back up and roll back. Oh, there we go. Head back into the center. So T1 and T1 rib. T1 and T1 rib.
Lots of swimming as well, man.
Yeah, you said it was a hefty paddle out this morning, didn't you?
Relentless.
Relentless. It's not even an advert for canned drinks, is it? Yeah. Lift up your head and back down. In at Saunton, in at Croyd.
Sawney this morning.
Yeah. Tuck your chin down to your chest, back to centre. Stretch right hand to right knee, and back round. Left to left, and back round. Right, QL, then we'll check the rotation of the shoulders, and then we're better. We're heading to knee town. So turn your head to the right, squeeze the right elbow flat against your side, and let go. Squeeze the left one in, and let go. Head back into the centre there. That was really slight, that change there, but I know with Steve, left shoulder, because of an old injury, it's always just keep an eye on it, so.
It's been a lot better, man.
Yeah, and it did, and this is an only just, so it's just keep on top of it, isn't it? Good, glad to hear it's been better. Well done, your body healing itself, hurrah. Okay, so into knee town. So anterior tibia, nope. Posterior tibia.
That was tender.
Tender, just what I'm touching on there, yeah. On that tendon junction, yeah. Okay. Yeah, I'm going to go medial tibia lateral femur shear. So that tibial plateau. And lateral distal end of the femur. There we go. So patella seems okay inferiorly. Absolutely does not like me doing lateral at all. Okay, you've got two options here. You can turn people over and do it. I think that's what it says in the textbook. A little bit of a sneaky cheat is do it this way for the camera. Grab the kneecap between your fingers, feel around so you can feel the lateral border. Make a gap between your fingers, get the tool on it so you're right on that kneecap. And we're putting the thrust there. And it's all to do with the little grooves of the kneecap sits in. If they get a bit inflamed or sore, and it's not tracking properly, so you get slight tracking errors. In other words, some inflammation inside the knee. Just pull your heel up towards your head. There we go. Hamstrings push against me. So push towards just straight towards the back wall. That's it. And let go. And very clear, you've got some big quad action going on. Right,
Yeah.
I'm going to be turning you over. So, over onto your back.
It feels quaddy.
Feels quaddy. Yeah. Four fins on the fish. Bit quaddy. Yeah. Okay. So, is this one, isn't it? Yeah. Muscle tendon junction, go looking for trigger points. And here's a bit of a sneaky one. This is not Activator, it's just what I would do under this circumstances. It's worth just checking it, just adjusting. There's usually a trigger point in that VMO, isn't there? Yeah. So, which is acupuncture points, medial knee of the eye of the knee. I would go with for good measure. Yeah. Cool. There we go. So getting a bit into a knee injury. Hopefully we'll report back that that has improved. See you next time. Oh, don't forget, do the like, subscribe, and all that kind of stuff, and find us on Instagram now as well. And yeah, there we go. You can do all that. See ya.